So these data are from a phase 2 study looking at the uh, agent MK-6482, which is a HIF-2α inhibitor. And this HIF-2α inhibitor is actually given orally and was given to 61 patients in this non-randomized phase 2 study. The primary endpoint of the study was objective response rate in the kidney masses. These patients all had to have a renal cell carcinoma from their von Hippel-Lindau disease, but we also looked at other lesions. So what we saw is that there was actually an objective response rate in the mid 30% range of patients. Up to 36% of patients had some degree of shrinkage in their renal cell carcinomas, and those were confirmed responses. And there were additional around 11.5% unconfirmed partial responses, and we're expecting those to turn into confirmed responses. Equally excitingly, we also saw that there were objective responses in the pancreatic lesions. Most of these patients, actually all of these patients, actually had some pancreatic lesion, either a pancreatic cyst or pancreatic neuroendocrine tumor. We saw that 63.9% of those decreased in size. Additionally, 43 of these individuals had hemangioblastomas, and we saw that there was an objective response rate by RECIST of 30% in those. We also saw in the 16 individuals who had retinal hemangioblastomas that there was the majority of them demonstrated either stabilization or improvement of their retinal hemangioblastomas. So we were seeing a fairly broad distribution of benefit across organ systems with MK-6482 in patients with VHL disease. So this agent, MK-6482, has been given breakthrough designation by the FDA. That means that the approval process for this drug is accelerated somewhat. The hope is that the data from this study are sufficient to get approval for MK-6482 in individuals with von Hippel-Lindau disease, and that's really the work that's being done over the next year to see whether or not the FDA believes that these data are sufficient. So the psychological burden of living with VHL disease, sort of having this sort of Damocles, if you will, of worrying that the next lesion is going to appear or grow is a huge issue. And the hope that this agent really provides patients with VHL disease, and the hope that my patients who are on this trial are expressing is really humbling and wonderful to see. And I sincerely hope, as an advocate for individuals with VHL disease, that this drug will get approved.